Hi, this is Dr. Salemi here at Oasis Animal Hospital. I'd like to talk to you today about canine heartworm disease. We feel it's an important prevention that we need to incorporate with every single canine patient that we see here at the hospital, more so for the benefit of the pet who is a member of your family, but also this disease can incorporate, leads to some suffering, can even possibly fatal. Heartworm disease is spread entirely by mosquitoes. The way it is spread, a dog that is infected with heartworm disease is bitten by a mosquito, and then the larva of the heartworm itself matures within the mosquito, and then that mosquito then goes on to bite another dog. As soon as that dog is then bitten, the larvae fall into that bite wound and then enter into the dog itself, and the dog is then considered infected. After infection, it takes anywhere between 4 and 6 months for those baby worms to mature within the bloodstream and then travel up to the heart, where they then live within the heart itself and into the vessels that enter into the lungs. At this point, they become mature, but by themselves living in the vessels, they create a lot of inflammation, which really irritates the vessels and makes the heart work a lot harder. From that point, they can become sick. A lot of times we don't actually see dogs become sick from heartworm disease until the heart has sustained a lot of damage and the lungs themselves have also sustained quite a bit of damage. Commonly, we'll see them present for even just a simple cough, or they're not wanting to play as much, chasing the ball in the backyard. The good news about all this, heartworms are one of the most preventable diseases we can treat and even prevent in dogs. It's as simple as taking the medication we have here in the hospital is called HeartGuard Plus. It's once every 30 days. It comes in a tasty, chewy treat that most dogs will love. And as they chew it, ingest it, it will kill off any of those baby worms that are manifesting within the dog after the mosquito has bitten them. The reasons that the medication are given every 30 days is that within a time frame of just over a month, the baby worms that mature after they've entered into the dog mature beyond a point where any of the medications we give can cause them to die off, and then they go on to become adult worms. That is why we always recommend that it be given monthly, every 30 days, just to ensure adequate protection of your pets. We do always recommend annual heartworm testing, and that test is a simple blood test that we use to see if there are any of the adult worms that have established living within the pulmonary vessels or near the heart. If that test is negative, we can then start on the monthly preventative. We do recommend here that we continue on year-long heartworm treatment. In some areas of the country, we are able to stop treatment during the winter time because it is cold enough and it's snow. However, in the desert, we don't have that climate and it's not severe enough of a winter to kill off any of the mosquitoes. And we do see infections year-round. Therefore, we do recommend that your pets be on heartworm preventative year-round. Ultimately, all of the treatments and medications we prescribe is always to ensure a good quality of life for your pet, which is a member of your family. Prevention of heartworm disease is one of those that I consider a must, that helps keep them, to ensure them to have a long, happy life, but also to protect some of the humans that also go with the members of our family. For more information about heartworm disease, I encourage you to go to our website, oasisanimalclinic.com. There are a lot of useful other articles on there, including from osteoarthritis to good nutrition. And then also, if you do want more technical information, I do encourage you to go to the American Heartworm Society webpage, and that's www.heartwormsociety.org. Or if you do have any questions at all about heartworm disease, I'm more than happy to speak with you. Please give me a call here at the office or email me as well. Thank you.